Hi, Laura. How are you?
I'm good. How are you, Dr. Asma?
I'm fine, thank you.
They're good. Let's build an empire.
Exactly. Yeah.
There's a lot of fun things coming in this space. We've been working long and hard. We're going to have a whole new regenerative menu of services that we're going to be rolling out here pretty soon. Going and moving an expanded version of medical aesthetics. So it's not just injectables, it's what's inside too, right?
Exactly. Well, and like regeneratives is really taking over this space, which is kind of phenomenal. I mean, I was reading something the other day that said that regenerative aesthetics is going to grow by a aggregate amount 16% year over year until 2030, whereas totality aesthetics on its own is only growing 10%. So if you see that regeneratives is growing 16% and aesthetics in its own is only growing 10%, and it's a far bigger subsection of it, regeneratives is actually growing far faster than aesthetics on its own, which is really
Yep.
cool.
And we're going to help lead that path. So hopefully
Yes.
we'll get even a larger growth once
Yes.
we hit
Yes.
our stride. So we're barely getting started. I can't wait to share it with you and move forward.
We are basically going live through our company, Rejuvian Health. This is one of the first of many series that we will be doing with our trusted partners. And the reason why we want to do this is because we want people to know why we have selected a partner in a city, why they should be going to them for any kind of treatment, consultation, advice, and how they are trained and why they're selected is something that we would want to discuss, along with you getting to know our partners better. So I want to start with a little bit of introduction. I basically head client success at Rejuvian Health, and with us we have a very special guest who is one of our first partners in San Diego. She has been with the board certified physician assistant in the industry for almost 9 years. She's worked along the medical director of AMI and then had her business for almost more than 9 years. So it's almost a decade, right? Laura, that you've been in since you have your own business and in the industry, correct?
Well, I've been in this industry for 9 years, but I've only actually owned my business for a year. Prior to owning my business and starting my own empire, I was working for the medical director of Allergan Medical Institute. So I was working for the pinnacle, like the highest of the high, and I decided I was helping him build his empire, and I was, teaching people how to do treatments and do Botox and do filler. And I was answering all these questions and mentoring people, but why am I not trusting myself and starting my own empire? So I decided to create the proverbial wings and fly on my own and create this business. And it's been astounding. I've been in business now for 13 months and I keep growing every single month despite this market being slightly downturned, is how we like to say it within the market. So I'm so excited for the future, and I have a different business venture that's coming out soon. So that's in regenerative aesthetics too. So it's just huge, and I'm so excited.
Well, I can't wait to get my hands on the product you're launching. I'm not going to say anything. That's, your story to tell. But
Yeah.
I do want to emphasize on the fact why we chose Laura. So one of the unique, traits that she has is that she actually researches a lot. She's very well informed and well educated. She loves reading. She just doesn't follow a trend because it's a trend. And she doesn't try to force you into a service on her service menu. When you sit with her, she does your consultation and she then, comes up with the treatment that's best suited for you, which tells you that she works on a care model versus a sick model where she's just pushing services out that don't really make a lot of sense. I want to ask you, I understand that, there's not a lot of time to discuss, as to represent who you are. But what do you think, in your eyes, makes you stand out as a business professional in your field?
I think it's exactly what you just said. We, especially entrepreneurs and business owners, oftentimes we're often confusing the dollar amount rather than the treatment that the patient actually wants today. I was actually in a consult this morning that was sent from a friend of a friend from one of my patients. And she was surprised when she would ask me, do I need this? And I literally would tell her, no, I would not waste my money on this because this is not something that would directly affect the complaints that you are seeing. And so by the end of the consult, she had bought into what we were talking about and the plan that we had created together. So I think a lot of times providers don't really empathetically listen to their patients and what complaints they're having. They just say, oh, the patient is asking me about this. I see dollar signs, therefore I'm going to just do what the patient is wanting. But really creating a plan that will do best by the patient is what creates the patient to come back, and that's what creates trust. And I tell people, I want to go to the grave with you. I don't, and I know that's a little morbid, but I want long-term relationships. I don't want to just see you for one time. I want to see you time and time again. And I have photos of people where it's taken 18 months to get to where they want. But we know in regenerative aesthetics, anything that is allowing your body to create its own results, we do have to have a little bit of patience. But that patience is so worth it. And it creates these results that are natural and yet profound at the same time.
I think one of the major things that a lot of estheticians or med spas don't realize is that when a patient comes through your door, they're not coming to buy something. They're coming to you with a problem which they do not know what the best solution is. So giving them time, understanding what's going on and what their actual need is, they trust you with that for you to define and advise. And I think you do a fabulous job at that. And this is why I love you, not only just as a esthetician, but also personally as a human, because you actually care. And thank you so much for that. Let's discuss a little bit about, regenerative treatments. We all know that it is seen and understood as the future of aesthetics. How do you stay ahead of the curve? What kind of concerns do your clients come with when it comes to because there's a lot of rumors out there, miscommunication, not too much education out there. It's still kind of new. What do you kind of hear? How do you kind of handle that? And what are you offering in regenerative treatments?
I think you hit the nail on the head, Dr. Asma, because even take me back 3 years ago, and that's really when I started to dive into regenerative aesthetics. Prior to that, I was really only dabbling in Botox and filler. Like if whatever complaint you had, it was either, okay, Botox will fix it or dermal filler will fix it. And I started to realize 3 years ago this idea of regenerative treatment, and that's where my passion has really thrived in. And I find that when the body is doing its own work, it is actually anti-aging, which we all are not trying to anti-age. We're all trying to age gracefully, is how I say it. And everybody's version of aging gracefully is very different. My version is very different than your version. It's very different than, say, if I had a twin sister. And so that's what I like about regenerative treatments, is because you can take whatever your version of aging is, and we can make it work with whatever you decide you want to do. So my favorite treatments are when patients have either a couple of different complaints. The ones that I hear the most are, I look tired, or I feel like my face just fell on the ground. And those are very different treatment plans for each of those options. Like if someone is saying that they feel like their eyes look tired, then we start focusing right in here. We start thinking about the temples. We start thinking about the under eyes. We start thinking about the mid face. Like how can we improve those areas with either regenerative treatments or dermal filler, whatever, but we can always decide what we want to do. If people start saying they feel sad, then we start focusing down here. And then we can do different treatments for those areas to improve that area. I would say my overall favorite treatment would be something that is an injectable, that's a biostimulant, meaning bio for life, stimulant for stimulates, so it stimulates life. So anything that is going to basically make your cells work and function as if they were younger you. And that really geeks me out on like a whole nerd level, like slide these glasses up. Because if you think about, say, I'm 39 years old, but if I can get my cells to work like they were 32, how cool is that? That is like so fascinating. And I just see these like little energized cells running all over the place. And it really makes me so excited. And it makes me so excited for my patients too, because if you can make a 70-year-old, her cells work like they were 65 or 62, she's going to have that glow of a 62-year-old. And that is really cool.
Yes, that is awesome. Now, I do want to quickly add that I am a living example of exosomes. Okay.
Yeah.
A lot of people do not believe that I am in my early 40s. And listen, I've got some issues. All right. But exosome has been very helpful for me, both for getting my hair back to, getting rid of my bald spot, treating the systemic issues I've had in my life, worked great as an anti-inflammatory. Like I was sick and tired of taking ibuprofen every day because of the inflammation I had every day. So many things, exosomes can be used up, but we want to focus on, of course, aesthetics, hair growth today. That's, the focus today. We have a question in the chat for you. What is the secret behind your beautiful skin?
I do have really good skin. I will brag about that all day. Yes. So I have done exosomes in my under eye. I've had those put in underneath my under eyes, and then I've done Sculptra all over the face, which Sculptra is a biostimulant as well as exosomes. They produce collagen in different ways. And that's pretty much what I've done to my skin. I also have like a really good skincare regimen. I think that skincare can move mountains as well, because I tell people what we do in the office should be like going to the dentist every 6 months. But are you not going to brush your teeth every single day? No, because that's disgusting. Who wants those kind of teeth? So you also need to go home and have a really good skincare regimen at home, because it offsets what we do in the office.
Yeah, I completely agree. I think being precautionary is a lot better than getting yourself to a level where you need to actually go for treatments. And doing a good skincare, I think it's part of that precautionary measure where prevent your skin to go through something really bad or come to a level where you actually need an invasive treatment. So you told us how you've used exosome also for yourself. You want to shed a little light on how you've used it for hair growth and, regrowth of hair, exosomes?
I have not used exosomes for hair growth, but I have used other things as far as like PRF and PRP for it. And I've also used platelet-derived growth factors as well for thinning of hair, not in myself because I have tons of it. But I have a couple of patients who are complaining about that I am about to start. They are starting in the fall. They're waiting for the summer. And then we're actually going to combine PRF with exosomes for both of the abilities and the capabilities of exosomes plus PRF. And I'm excited to see their results, because PRF exosomes for the hair is phenomenal when done appropriately. You have to do it in the right spot. You have to know the difference between male patterned baldness and female patterned baldness, because they are different. If you try to inject a female where the male should be injected, you won't get the results.
Oh, wonderful. I want to cover this a little bit. So people who are actually doing PRP and PRF right now can definitely add exosomes into that treatment to enhance the results. guys, so anyone, I'll take my example because, that's the best example to give. Severe hair thinning and hair fall because of postmenopause, which was forced on me because of hysterectomy. One of the biggest reasons why a lot of people lose their hair, especially women, or hair thinning, is because of hormonal change or age or postmenopause. But it's usually hormonal, or traumatic or stress related. Exosome on its own can fix the problem. A lot less sessions, a lot less pain, a lot less downtime as opposed to other treatments. But if you are getting PRP right now or PRF, adding that with, adding exosomes to it can enhance the results. And remember to speak to your doctor or esthetician about this because they're the ones who are going to guide you properly. They're the ones who are educated on how much or even if it's good for you.
Well,
So
and the
I
thing that
think,
I
yeah.
love the most about exosomes is that I describe, because people don't know what exosomes are. People don't know what PRF is. People don't know what anything is. And I always tell people it's my job to know, and it's my job to educate you on what it is. So I explain exosomes as they're tiny little messengers, kind of like today we send text messages between you and I if we want to communicate. PRP is similar to the snail mail. It's not, it's going to get there. It's going to take a really long time. It's going to go all over the world and then come to you. The exosomes are little tiny messages from one cell to another cell telling these cells what to do. But what makes it huge is that it also has mRNA. mRNA is basically the guideline to tell people how to create new cells. And so it creates new cells faster and better. It also helps decrease inflammation. It also has growth factors and also has peptides, which are all the building blocks of collagen and elastin, which is amazing.
Yeah, I completely agree. I mean, your decision, right? More sessions, result that comes in a lot of time versus something faster, more authentic, more effective. We have a question here. Same here, hair thinning, nothing worked so far. Tried PRP, a few sessions, looking forward to trying exosome treatment. I mean, now is the time, Sid. This is the time for you to start. The sooner the better. You see something going bad in your hair, face, skin, body, the faster you go to someone to get advice on it, the easier it is to get it back to the original state. Kenton, 1,000+ growth factors in exosomes versus PRP. That is correct. The more the growth factors, the faster the result and the better the result. So it actually has the power to fix more. Laura, I would like you to talk a little bit about, your upcoming plans. What are your favorite treatments, and what do you actually see more coming through your door these days?
Well, it really depends on the time of year. It's very interesting because during the summertime, people tend to concentrate more on like their skin and discoloration with their skin. Towards the end of the year, when the holidays are coming into play, then people really tend to focus on their eyes and they tend to really focus on their mouth. And the reason is I think like people are like, we're getting married. We like to drink our wine or whatever, and we like to put on our glitter eyeshadow, and so we're seeing these areas a little bit more. And then during the summer times, we're wearing our summer dresses, so we're just looking at our skin a little bit more. So it's very interesting how the fluctuations of the industry works. And so right now we're in the summer, so most people are concentrating on discoloration. They're wanting to really show off their chest area, their neck area. There's definitely treatments that we can do for each of those. And then more towards the fall, the winter, people are more focusing on their under eyes. They're focusing on their lips, so they want something with their lips. The thing I will say that I love about exosomes that is different from PRP or PRF is that PRP and PRF require your body to create its own results. So if your platelets aren't good, the result won't be good. And that's the nice thing about exosomes, and the reason why I choose exosomes sometimes is because I know the patient is malnourished, especially here in South San Diego. We don't really eat that much because people are focused, and we also take a lot of GLPs here in Southern California, and so their platelets are not going to be as healthy as if they eat really healthy. And so exosomes is a really nice treatment because it bypasses your own platelets, and it uses these derived platelets and these derived growth factors to create the results. So it's nice because it takes it outside of your body.
Thank you so much. The exosomes that you choose whenever, let's say, your esthetician advises it, you need to ask them a couple of questions about that exosomes. Where is it derived from? What generation is it? Is it first? You can get all the way till 7th generation. It needs to be the first generation. It needs to be extracted from not more than 4 passes of stem cells. So stem cell excretes exosome, which is the communication system between your stem cell and your normal body cell. You already have it in your body. What we do for you is we grab the youngest, most potent, purest form from the Wharton jelly of an umbilical cord and isolate it into a vial that is available to our trained professional partners. All right.
And I would say that the biggest question that I get from anything that is not your body, and especially when it comes to regenerative treatments, because again, like, it is a new industry, which is fascinating. Aesthetics as a whole is still a little baby. When you think of medicine is an adult, but aesthetics, this is an industry in which a lot of people don't understand. We're still learning. What I used to do 5 years ago is not what I do today. And what I do today is probably going to be very different than what I'm doing in 5 more years. And that is what is so fascinating for us as providers, but that is also what can be a little bit scary from the patient standpoint, because they're like, well, if you're always changing, then what you're doing today, is that dangerous? And the answer is no, because I personally go to at least 2 to 3 trainings a year, where I'm being trained by the best of the best. And so I'm constantly learning, constantly adapting, constantly treating different ways and learning the best way to find it for that moment. And the best way today is not going to be the best way in 6 months. But a lot of the questions that I get is this safe? And the answer is yes, it's 100% safe. We are constantly filtering out, like, we're trying to find the best ways to make it 100% safe. And we've done a really good job of that. We would never do anything that is not safe for the patient. I always tell patients the day that I stop becoming nervous is the day that I stop injecting. And the reason is because we always need to have a sense of anxiety, because we are messing with people's faces. So we want to make sure that we're holding that standard to the highest standard, because it is your face, it is your body.
Yeah.
We need to make sure we are safe.
Yeah. We do have a question here. Sure, Trend. I think we have a couple of questions here. How safe is it if we combine it with PRP? It's totally safe.
Yes. So the cells communicate with themselves for about 3 weeks. So if you place exosomes anywhere, either topically or you put it wherever you want, it is communicating for about 3 weeks. So I get my patients to do the treatments every 3 weeks, because then you're creating the new baby cells for 3 weeks. But then after that, there's no longer that open communication, is how I describe it. And now it becomes more like snail mail. Well, guess what? We need to open that communication back up. So then we do another treatment of exosomes. Now you're doing those text messages that are immediate, but that will go away within a couple of weeks. So then you just want to retreat it. And then there's the corrective phase and the maintenance phase. During that corrective phase, you want to keep it every 3 weeks, very, very like strict timeline. And then during the maintenance phase, when you're just trying to keep the great results, then we can do it once every 6 months, once every year, because now we're just keeping up with the goodness.
Thank you so much, Laura, for that. We have another question for everybody loves their skin. So it's a direct question for you from Harim.
Have I tried any of these treatments on myself? I have tried them. I have not done them on myself, but I have done exosomes underneath my eyes. I did notice a big difference in my under eyes. I had old filler underneath my eyes, and I dissolved the filler because the exosomes looked so good. So I didn't even need filler underneath my eyes anymore. And that's my go-to treatment is exosomes under the eyes because it's natural. It attacks both dark eyes and the lost volume in eyes. And that's what people complain about is dark sunken eyes. It fixes both.
I mean, that's one of the major issues, right? And I just want to add one thing here. You guys can see her eyes, you guys can see mine. One of the biggest things that people don't understand is not every issue can be resolved by putting something on top. Sometimes you have to fix it from within, something deeper. Again, I'm going to repeat this. Exosome goes in and it fixes the problem from within on a cellular molecular level. No cream, no product does that, okay? And this is why it can be combined with an existing treatment like Laura does based on, whatever the patient requires or on its own, again, depending on what situation is. We have another question from Trend.
How long do the results typically last for? And how long afterwards do we need maintenance? So this is a great question. So last January, so January of 2024 now, when people used to ask us how long did collagen last for, we'd say, I don't know, it lasts for several years, right? Because we do treatments and you look good for several years. We didn't know how long. Well, this study came out last January of 2024 that has now proven that the collagen we are making today lasts for 17 years. So that means we have collagen inside of us that is 17 years younger than us, which is quite phenomenal. So when we upscale and upregulate our collagen production and elastin production, we are actually increasing the results and getting on another whole line for about 17 years, which is really, really cool when you think about that because we're not making changes for the next year, we're making changes for the next 17 years. And so I always tell patients it's never too late to improve collagen results. And who doesn't want the collagen that we have today 17 years down the road? And then I usually recommend that patients do regenerative treatments. During the corrective phase is a different set, but during the maintenance phase, once a year, we want to just do that maintenance. And the reason is because we don't want to ever have to do that corrective phase. The corrective phase is a lot more intense. You have to come back and see me quite often. It's a little bit more expensive and we get to be BFFs, but nobody wants to block time to come and see me all the time. And so if we stay on top of our maintenance, then you don't have to see me that often.
Yeah. Again, same thing. You want to make sure you keep yourself in a position where nothing bad happens, or do you want to wait for the condition to go bad and then get treated? So exosome can be used as a precautionary measure to keep yourself healthy, young, go back in age, keep your hair healthy, skin healthy, and not needing to come to a place where you would need a list of treatments for separate issues. We're very close to, because we started 5 minutes late, we have added 5 minutes extra. Guys, we are going to do this on a regular basis based on if Miss Laura is available. So any questions you send, you can directly send to Bold Aesthetics. In the caption, you will find, and on our page also, you will find everything about Laura and her establishment and her booking link for consultation. her contact number for consultation. Anything, Laura, that you would like to add before we conclude this live?
No, I just appreciate y'all taking the time to meet with me and, hearing what I have to say. I have the gift of gab is what a lot of my patients tell me. So I love talking. If you have any questions, I would love to answer any of those offline. We can create a little conversation, and I love directing patients to the right places.
Awesome. Thank you so much. It's always a pleasure to talk to you. You know I love you. And
As
I
well
love
as
how you
you.
work. Oh, thank you. Appreciate it. I am sure that a lot of people will have questions, guys. You can find all of our details on our page. And go ahead and contact her directly or send your questions to us, and we can go ahead and forward those to Laura or schedule you with Laura. You can always drop if you're interested in DM here. I am so happy and thankful that you joined us. I know you're crazy busy and would love to have you again with us, okay?
Yes, definitely.
All right. Thanks, everyone. Thank you so much for your questions and your support. We're definitely going to see you within a few weeks, probably with another partner. Take care. Have yourself a great week ahead. Bye.
Bye, guys.